I'm Dr. Maria Quintero Conk, licensed psychologist at Tri-County Behavioral Health Care. Today I'm going to share some information with you about autism spectrum disorders. Now, in a brief video, we can't cover everything about autism, but maybe just enough to get you some information and some contacts. So let's get started talking about autism. What is autism? Now, autism spectrum disorder is not a disease, it's not contagious, and it's not something that a person needs to change or can change just by wanting to or being told to change. Autism spectrum disorder is a neurological condition. It's neurodevelopmental. It starts during the developmental period when someone is very young. Some people describe autism as being neurodiverse. There is a broad range of how our brains can operate. Some people are deemed neurotypical, and some people have a different way of processing the world. That's neurodiversity. That's the autistic brain. And autism can start showing very early in life, but for some people, it may take a while for the neurodiversity to show. Is autism spectrum disorder a mental illness? No, it's not. It's not an illness at all. Autism is not a mental illness. It's a different way of processing information in the brain. In 2021, approximately 1 out of every 44 children could be diagnosed with autism. It's actually a pretty common condition present in about 8% of all children. What are the signs of autism? One of the signs of autism is challenges in social communication and reciprocity. Social communication is how we communicate with other people to make our needs, wants known. Social reciprocity is that ebb and flow, give and take of social interactions, like conversation. The person with autism has difficulty in these areas. They may not be interested in other people their age, or may find it very difficult to be with their peers, very effortful. They may be able to tolerate them just for a short period of time and then want to isolate themselves. They also may lack play skills that are appropriate for their age or lack imaginative play. They'll have difficulties in nonverbal communications, gestures, facial expressions that we learn to read in other people and to use to communicate. Those can be challenging for the person with autism. And finally, developing, maintaining, and understanding relationships, like friendships. That can be a very big challenge for folks on the autism spectrum. They may want to make friends. It isn't that the person with autism isn't interested in having friends. They just may find it very effortful to do and effectively not be accepted by other people and their other peers. The other area of challenge for people with autism are restricted repetitive behaviors. Restricted repetitive behaviors may include repetitive motions, motor actions, such as flapping their hands or walking in a particular way, or repetitive verbal behavior, like repeating the last word in a question or repeating some little snippet of a program that they may have seen on TV. There is also the characteristic of insistence on sameness. The person with autism can get very tied to a routine and not tolerate changes in their environment. They may insist on taking the same route every day from school to home, whether or not a road might be blocked, or insist on having things in a particular order or line up toys in the precise order and become distressed if someone makes any changes. They may also show highly fixated, restricted, or unusual interests. They may be interested in a particular object, like collecting rocks, or they may be collecting rocks in a way that may be excessive. They may be interested in toilet seats. They may be interested in shiny objects, things that are unusual for folks, and things that are obsessively interesting to the person, so that taking any of those objects away or restricting them or disturbing them may cause them distress. And finally, the person may be hyper or hypo-reactive, may overreact or underreact to sensory stimulation. For example, a sound that may not be disturbing to anyone else may be painfully disturbing to the child with autism, so much so they may hold their hands over their ears to block the sound. Or they may look at objects because they like the visual stimulation. They might sniff objects or people. They might taste things that are not edible. They may be sensitive to different materials on their clothing. Or they may under or overreact to pain. These characteristics are common characteristics of autism and are criteria for the diagnosis. Autism is also diagnosed at 3 levels. The Diagnostic and Statistical Manual, the 5th edition, lists out the criteria for those levels. Level 1, 2, and 3. Level 1 is needing supports. Level 2, needing substantial supports. And level 3, needing very substantial supports. Now, how early can we diagnose autism? How early do these symptoms actually appear? Early diagnosis is very important. Now, some children can be diagnosed as early as 18 months, and some children by 2 years very clearly have autism. Interestingly, the American Pediatric Society recommends that pediatricians do screenings at the Well Baby Checks at 18 and 24 months. However, many children are diagnosed later, and some people are actually diagnosed in adolescence or adulthood, when those demands of their environment become so great that they can no longer resist and have difficulty integrating. Other common behaviors of autism spectrum disorder: tantrums. We hear much about tantrums. These may occur from environmental factors. Too much is happening in the individual's environment. They become overwhelmed and they start screaming, yelling, crying. Often it is that sensory overload that produces the tantrum. It can also occur from changes in routine or not having an object that the person is particularly attached to. Self-injury is seen in many people with autism. They may bite themselves, scratch themselves, bang their heads, and can inflict injury on themselves. The reasons for some of these behaviors are unknown. Certainly there is frustration, and since many people with autism cannot speak or cannot communicate well, lack of communication can also stimulate this kind of behavior. Always we need to consider that a person who is behaving in this way is trying to communicate something, and it may be their frustration at their inability to communicate that produces this type of behavior. With children with autism, we can also see aggression. They may hit, kick, bite, throw objects at others, and the reasons are similar to the tantrums. Again, the inability to communicate what they want and to do so in an effective manner. Sometimes people with autism behave this way because they want to be left alone and they don't know how to say it, or they're saying it and those of us in the environment may not be honoring that need. And finally, stereotypic behaviors. That's the terminology used for behaviors such as rocking in place, rocking back and forth, side to side, hand flapping, walking on toes, so toe walking, spinning, and making repetitive sounds. These are all characteristics of autism. Now, curiously, some of those stereotypic behaviors, while they may seem odd to folks, could be very soothing for the person on the spectrum. They may be actually doing the behavior to calm themselves down and can become upset when interrupted in this process. On the other hand, the behaviors can become all-consuming and can interfere with the person's ability to learn and to interact with others in their environment. A word about girls on the autism spectrum. Now, the ratio of boys to girls is often reported to be 4 to 1, so 4 boys for every girl that's diagnosed with autism. But in the research on autism, we're learning that there are more girls that are not being identified and diagnosed. Girls with autism actually may show their characteristics a bit differently. Girls seem to learn enough social interaction to at least be integrated superficially. Now, if we look more closely, they have trouble understanding the interactions of other girls, of their peers, and they'll report that it takes a great deal of effort to maintain those interactions. This process is called masking, and because some girls are pretty good at masking, they struggle and they have great difficulties, but they're floating along and their diagnosis may be missed until they get older. Does autism have a cure? There is no cure for autism, but remember, autism is not an illness that needs to be cured. There is no medical treatment that makes autism go away. And many advocates would say autism does not need to go away because, again, it's not an illness, it's a different way of viewing the world. What we do see, though, is that autism can co-occur with other diagnoses. Although it itself is not a mental illness, people with autism can develop mental illness and can be diagnosed with that. One of the more common conditions is attention deficit hyperactivity disorder, or ADHD, which is often identified in childhood. But depression is often seen in late childhood and mid to early adolescence in people with autism. The depression often is produced by the fact that the person recognizes that they have the autism, would like to be more integrated socially, but just doesn't know how. And the demands of their social environment in school, at home, and other places just become too great. People with autism can also be diagnosed with an intellectual disability. Now, so what's the difference between autism and an intellectual disability? People with intellectual disability have challenges in learning and in adaptive behavior. Specifically, they have deficits in intellectual functioning, what we call intelligence, which is measured by IQ tests. In the state of Texas, the definition of an intellectual disability for state services is an IQ less than 70. Only about a third of children with autism have an intellectual disability or have an IQ less than 70. About 25% are in the range of 71 to 85, which is more of a slow learner, but not a person with an intellectual disability. And approximately 40% of people with autism do not have cognitive or intellectual deficits at all. So the two can co-occur, but definitely do not need to happen together. How is autism diagnosed? Well, there's no blood test, there's no physical medicine evidence that can be taken to confirm an autism spectrum disorder. The diagnostic process involves taking a detailed developmental history to see when the characteristics began, direct observation and interaction with the child or the individual being assessed, and then there are tests that formalize these observations. The more common tests that families may hear about, the Autism Diagnostic Observation Schedule, the ADOS, the Autism Diagnostic Interview, ADIR, or the Childhood Autism Rating Scale, the CARS. There are others that are being developed, but those three tend to be the most common that families will find in clinics. So, you'd like to see if your child qualifies for an autism diagnosis? Where do you start? Well, the first place is to talk with your child's pediatrician. Remember, they do these screenings and may be able to provide some referrals depending on what they see. You can also seek an evaluation by a physician, a child psychiatrist, a neurologist, or a psychologist who has experience with autism spectrum disorders. Or you can call your local Intellectual and Developmental Disability Authority, LIDA for short, for an assessment. What is a LIDA? The local Intellectual and Developmental Disability Authority, or the LIDA, they serve as the point of entry for intellectual and disability services in the public system. Every county in Texas is served by a LIDA, and you can find the LIDA for your county by contacting HHSC, and we're providing a link for the online method to be able to find the LIDA that serves your county. When you contact the LIDA will conduct testing to determine the IQ level, to determine the level of adaptive behavior skills, and to see if an autism spectrum disorder is present. People with autism spectrum disorders are eligible for some services. Depending on the results of the assessment, you will be able to determine which services apply to the individual. Tri-County Behavioral Health Care is here to provide more information. Please call us if you have questions or would like to pursue an assessment. Our number is 936-521-6200. Thank you.